at your international news now. The impact of the global gag rule reinstated by US President Donald Trump in his first week in office will impact vulnerable women and girls in Africa, according to health rights campaigners in Kenya. Now, the rule, also known as the Mexico City policy, prohibits recipients of US funding from offering abortion-related services. And organizations that refuse to sign or adhere to the global gag rule, also known as the Mexico City policy, will lose funding of the U.S. Agency for International Development, USAID, including donated contraceptives and U.S. technical expertise. Nairobi-based Center for Reproductive Rights says thousands of women in Kenya will be affected by the unmet need for comprehensive health care, as Sarah Kimani reports.
At a health clinic in Kenya, expectant mothers undergo antenatal care. Here they receive not just information on their pregnancies, but how to space their children. Some of the women are as young as 16, teenage mothers. The idea to assist them make informed decisions on their reproductive health. So successful has a comprehensive section reproductive health care been that some teenage mothers have managed to resume school and earn a decent living. Now, health campaigners in Kenya are worried that the gains made will be reversed by the reinstatement of the global gag rule by the Trump administration,
which takes away US funding for any work that is related to abortion care. Other than abortion work, it also stops funding for any organization that uses its own funds to work around abortion, access to information on abortion, training on abortion, but also counseling on abortion. So it's not only about services, but it's also about information around abortion.
Marie Stops Kenya, one of the healthcare providers partly funded by the US, says in a statement, because of the policy, the organization will not be able to provide contraception to at least 75,000 Kenyan women. They predict an increase in unwanted pregnancies and unsafe abortions. An estimated 1,200 women and girls die every year in Kenya due to unsafe abortions. There are fears that many clinics will shut down due to funding constraints.
When they close these clinics, what you see is also an effect on family planning, because a lot of organizations prefer to provide comprehensive health care.
At least 57% of Kenya's healthcare budget is donor funded. Any withdrawal of services will have an impact on the most vulnerable groups in the East African nation.
That we will either have services or not have services, depending on who is in power in America. And this is a serious challenge to our own governments to commit substantial amounts to our health budget.
Some European countries have pledged to chip in to fill the funding gap likely to be left by the Mexico City policy. What is not clear yet is whether the funding will be enough to keep services running across the country. Sarah Kimani, SABC News, Kenya.